Many eye diseases have no early symptoms. They may be painless, and people may see no change in their vision until the disease has become quite advanced. The single best way to protect vision is through regular professional eye examinations. And for this purpose, proper guidelines for the management and treatment should be adapted to protect the vision of patients. So the first thing is to know that eye problems varies from eye pain to double, poor, or blurred vision. Then you should be familiar with the factors which exacerbates the eye problems, including looking in a particular direction, wearing contact lenses, eye injury, the presence of an object in the eye. Now here is some important information you must know related to eye problems, which are: never try to remove a foreign object that may be deeply embedded in the eye. If patients have exposed their eyes to chemicals, make sure to wash them out thoroughly before doing anything else. If they are experiencing sudden blindness or eye injury, they should seek medical attention as soon as possible. Now there are some important questions that you need to ask your patient before making a diagnosis. You will ask your patient what symptoms of disease they are experiencing, including blurry or loss of vision, eye pain, eye redness or discharge, intolerance to light, double vision, tearing, dryness, irritation or swelling in the eyelid, seeing halos around lights, headache, the date of last eye exam, protuberance of eyes, trouble speaking, steadiness on feet, any other changes in movement or senses. Now you will ask the patient if they are experiencing double vision. If the double vision is occurring in one or both eyes, if they see it everywhere they look, if it is constant, when it began, and whether its onset coincided with injury to the head or eye. Now you will ask your patient if they and anyone of their family have these diseases, including thyroid disease, diabetes, high blood pressure, nervous system disease, heart disease, previous eye disease, migraine headaches, allergies, glaucoma, cross eyes, wall eyes. Now you will ask your patient if they have been exposed to any dust, metalwork, or toxins, such as wood alcohol or smog. One more important question you need to ask is what medications are they taking, including eye drops, eye ointment, adrenal steroids, the antipsychotic thioridazine, the malaria medication chloroquine, the antibiotic ethambutol. You will also ask the patient if they wear contact lenses. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes blood pressure, tests of their reflexes and movement, thorough eye exam. As part of the eye exam, you may ask your patient to look at a distant point and then uncover one eye, or to look at a chart through a pinhole. You will also check under patients' eyelids or use an instrument to check pressure in their eyeball. Depending on their symptoms, you may order a CT scan or MRI of their head. Now, what can cause eye problems, and what is typical for each cause? Well, there are different causes of eye problems which we are going to discuss. Now, if the patient shows double vision and symptoms like protruding eyeballs, eye pain, double vision appears when looking at certain directions, then this might give you an indication that patient has eye muscle impairments. Well, this is a problem in the eye muscles resulting from a tumor, trauma, or thyroid problems can also occur after injury. But if your patient has double vision with typical symptoms like cross eyes, wall eyes, squinting, may worsen when tired, poor vision in one eye, sometimes family history of problem, then this might be an indication to strabismus. Well, strabismus is caused by lack of coordination between two eyeballs. But what if your patient is having double vision along with headache, pain behind the eye? Then this is intracranial aneurysm or stroke, which is abnormal ballooning of the blood vessels in the brain. If the patient has double vision with symptoms like headache, pain behind the eye, then diabetes might be a reason to this. Well, this is an inability to process sugar correctly. But if your patient has double vision with typical symptoms like trouble walking, trouble speaking, vertigo, movement problems, then this might be an indication to brainstem disease. Well, this is a problem affecting the structure that links the brain to the spinal cord. If your patient has double vision with typical symptoms like muscle weakness, trouble talking, double vision that worsens as the day progresses, sometimes drooping of the eyelid, then this might be an indication to myasthenia gravis. Well, myasthenia gravis is autoimmune disease that causes muscle weakness. Now, if the patient shows double vision with symptoms like double vision, sometimes lack of vision in certain spots, sometimes associated with unusual growth or other problems, then this might give you an indication that patient has pituitary tumor. Well, this is unchecked growth of cells in the pituitary gland, which is right above the nerves that travel between the eyes and the brain. Now, if the patient in emergency shows symptoms like vision disappears quickly and painlessly, sometimes feels as if a veil has descended over the eyes, then this might give you an indication that patient has sudden blindness. Well, sudden blindness is sudden loss of vision that can be due to blockages of blood vessels, damage to the retina, or if temporary, multiple sclerosis. Now, if the patient in emergency shows symptoms like eyes painful and red, headache, nausea, vomiting, blurred vision, halo around lights, may be precipitated by darkness or stress, then this might give you an indication that patient has acute angle closure glaucoma. Well, this is sudden buildup of pressure in the eyeball. If the symptoms in emergency are infection in the layer that eye is sore and red, blurred vision, intolerance to light, then corneal ulcers might be a reason to it. Well, this is a state covers the pupil and iris, often occurs after scratch, use of contact lens, or presence of foreign body in eye. Now, if the patient in emergency comes with washed out eyes instantly, then this might give you an indication that patient has chemical injury. Well, this is exposure of chemicals to eyes. Now, if the patient in emergency shows symptoms like sometimes pain, may occur after feeling only speck in the eye, hammering, grinding, or using power tools, then this might give you an indication that patient has penetrating injury. Well, this is state when object strikes eyes. Now, if the patient shows blurred vision with symptoms like poor vision, nearsighted, vision improves when looking through a pinhole, vision may be worse in one eye, more common in patients less than 4 to 5 years old, then this might give you an indication that patient has refractive error. Well, this is the eye is unable to properly process light, causing blurred vision. Now, if the patient shows blurred vision with symptoms like poor vision in one eye, eyes may turn in or out, more common in children, then this might give you an indication that patient has amblyopia. Well, amblyopia is one lazy eye is unable to fix accurately on objects. Now, if the patient shows blurred vision along with symptoms of painless, gradual vision loss, more common in the elderly, and people taking steroids or those with a history of eye disease, then this might give you an indication that patient has cataracts, which means clouding in the lens. Now, if the patient shows blurred vision along with symptoms like difficulty reading, vision improves with distance. More common in people over 4 to 5 years old. Then this might give you an indication that patient has presbyopia. Well, this is loss of elasticity in the lens. Now, if the patient shows blurred vision with symptoms like blurred vision, loss of peripheral vision, this is an indication of chronic blurred vision, which is a progressive form of glaucoma. If your patient has blurred vision with typical symptoms like overly large or small pupils, then patient might has taken a toxic drugs. Well, this is caused by overdose of medications and eye drops. And if your patients have blurred vision with typical symptoms like worsening of vision, more common in the elderly and people with diabetes, high blood pressure, or atherosclerosis, then this might be an indication to retinavascular. Well, retinavascular is a problems with the eye blood vessels. If your patient has inflamed eye with typical symptoms like eyelid feels covered in sand, eyes burn and tear, blurred vision, mild if any, intolerance to light, this might give you indication that patient has simple conjunctivitis. Well, this is inflammation in the membrane that covers the whites of the eyes and lines the eyelids. Now, if the patient shows inflamed eye with symptoms like severe intolerance to light, eye is sore and aches, blurred vision, then this might give you an indication that patient has acute iritis. Well, this is inflammation in the iris, the pigment surrounding the pupil. If the patient has inflamed eyes, symptoms like intolerance to light, sometimes eye feels sore or covered in sand, then herpes keratoconjunctivitis might be a reason to this. Well, this is inflammation in the cornea or membrane that covers the whites of the eyes and lines the eyelids, caused by a virus. If the patient has inflamed eye with symptoms like acute or chronic red eye, pus, only in people who are sexually active, then sexually transmitted disease might be a reason to this. Well, this is eye problems caused by diseases such as gonorrhea or chlamydia. If the patient has inflamed eye with symptoms like eye is painful and red, headache, nausea, vomiting, blurred vision, halo around lights may be precipitated by darkness or stress, then acute angle closure glaucoma might be a reason to this. Well, this is sudden buildup of pressure in the eyeball. If the patient has foreign body and eye with symptoms like eye feels as though something is in it, then conjunctival foreign body might be a reason to this. Well, this object is in conjunctiva, the membrane that covers the whites of the eyes and lines the eyelids. If the patient has foreign body and eye with symptoms like pain, intolerance to light, occurs in people who wear contact lenses or had something fly into their eye, then corneal abrasion or foreign body might be a reason to this. Well, this is something has entered or rubbed against the covering of the iris and pupil. If the patient has foreign body and eye with symptoms like blurred or double vision, then blunt injury might be a reason to this. Well, this is an injury to the eye. If the patient has lid problems with symptoms like tearing, red and itchy lids, painful, pimple-like object on the lid, then sty might be a reason to this. Well, this is painful, pimple-like object near the eyelid. The patient may have lid problem due to allergies. If the patient has lid problems with symptoms like chronic red, dry, itchy, and irritated lids, crusty material in lashes, then blepharitis might be a reason to this. Well, this is inflammation of the eyelids. If the patient has lid problems, symptoms like constant tears, then chronic tearing might be a reason to this. Well, this is the eyes continually produce tears. If the patient has lid problems with symptoms like swollen, tender skin near the inner eye. Endocriocystitis might be a reason to this. Well, this is a blockage and infection of the tear sac between the inner eyelids and the nose, most common in infants. If the patient has other eye symptoms like jabs of pain often occurs near the eye, then tic douloureux might be a reason to this. Well, this is nerve problem causing facial pain and spasms in facial muscles. If the patient has other eye symptoms like seeing spots or flashing lights occurs before headache, then migraine headache might be a reason to this. Well, this is a severe headache. And lastly, if the patient shows other eye symptoms like eye bulges out, trouble seeing, double vision, then this might give you an indication that patient has proptosis. Well, this is characterized as eye sticks out, a result of tumor or certain other conditions. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of eye problems. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.